Hey everyone, welcome to my show, My So-Called Fabulous. I'm Tiffany. It's so good to talk to you again today. We are back with Jim Hrncir with Las Colinas Compounding Pharmacy and Wellness Center. And we are on part 2 of our series. We talked about hormones for most of the part for females last week. And now we are talking about male and female libido and more hormones and more hormones. So welcome to the show. Back to the show, Jim.
Thank you so much. I love being here with you. Thank you.
Oh gosh, it's so great to see you again. And please go back and listen to the first part of this series. We talked about so much goodness that you need to hear, especially females. We did focus more so on bioidentical hormone therapy, which I have been on since 45. And I think I'm doing pretty well.
You are amazing, by the way. I thought you were 12.
Oh gosh, yes. I mean, this jacket's 12. But thank you. But you know, what a difference in my life. And you were talking about in the last show, a woman that stopped taking their hormones. I can't imagine, because Jim, when I slip, when something falls and go out, and when I'm checking my levels, I know right away. It's true, right?
Oh, absolutely. You can tell because it affects your quality of life as well as your health. You know, and either one of those is a good enough reason to use hormones, the proper hormones, and maintain the proper hormone balance. But quality of life is giant to me. I mean, because we only get one ride through this life, and it's such a gift that we were given, and we should enjoy that ride, right?
Just enjoy it.
But isn't it great that you get a twofer? Because you get not only quality of life, but you're going to be healthier. Matter of fact, women who use bioidentical hormones live an average of 4 years longer.
Wow.
Mm-hmm.
4 years.
4 years with better quality of life.
Absolutely. You know, what a difference. And I didn't say this to you in the first part of the series. I didn't do well on birth control. I really didn't. We would try different forms, but I either had weight gain or headaches or whatever the case may be. So I was pigeonholed into thinking that when I eventually hit perimenopause, that I could not take bioidentical hormones. I was inaccurate. 100%.
And that's true. And what you did not understand is the science behind that. And the science is that if it's a hormone, it's naturally occurring in the body. If it is a drug, then some drug company may have taken a hormone and chemically altered that hormone in order to get a patent on it, because hormones are not naturally occurring, can't be patented. So they can patent a chemically derived version, and so it's no longer a hormone; it's a drug. It has different effects, different side effects, which is clearly delineated in the Clinical Endocrinology for Gynecologists, the textbook that gynecologists study in med school.
Wow. Amazing.
So yes, what you were feeling is true. Mm-hmm. Matter of fact, I had a consult with a young lady, a college age student this morning, about that exact same topic. She can't take birth control pills. They make her feel horrible. And so she was worried that if we put her on natural progesterone, that she would feel the same way.
And this young woman is in college, and already she's considering taking progesterone.
Yes, she already has progesterone deficiency.
Done it. Mm-hmm. Oh my gosh, this is
I don't usually find that, I'll be honest with you, but this is a special case.
A special case.
Mm-hmm, yeah.
I mean, and it's amazing. I mean, that we can learn these things for sure. So we're talking about libido, and I've shared with my audience before that I have extremely low libido. My testosterone, according to Dr. Leanne Scott, my physician, my testosterone is exactly where it should be. Mm-hmm. What do you say to those women and men that are level with their hormones, but the libido's just not there? Is that a mental thing?
Well,
is that out of your realm?
Before we get to the psychosocial mental, we should say that giving just one hormone does not make your libido happen. Matter of fact, libido is dependent on quite a few things, and on women, we like to maintain a balance of the actions of all the hormones. So that means we got to get estrogen right, progesterone right, and testosterone right, maybe even DHEA, in order to get the libido as good a chance as we can get of getting libido up to snuff, okay? Mm-hmm. And once we get that balance going, then we say, okay, what else do we have to work with? Well, do we have psychosocial? That's when we got to get into that.
Right.
But sometimes we can do like little just helpers. Mm-hmm. Like for instance, we've noticed that when we use giant doses of testosterone for a short period of time, women's libido goes up like sky high.
Wow.
I mean, I could tell you all kinds of great stories that my patients have told me that would make you just laugh, but about experiences with high testosterone and how they had irrepressible libido for a short period of time. Mm-hmm. But that's not sustainable. Right. Okay, it isn't sustainable. The brain will not sustain that libido level. So what we can do is we can do event planning. Mm-hmm. And event planning is something that I developed a couple of formulas. We have one called Scream Cream, another called Yell Gel, and I didn't name those. My patients named them.
And here it is. I'm holding it. This is my new prescription.
And so
Yell Gel, right?
You've got Yell Gel here, and it has testosterone. It has sildenafil. Sildenafil is what is Viagra. Okay, mm-hmm. And it has a third ingredient, naltrexone. Now, what these three things cause is the testosterone stimulates the libido receptors in the clitoral area. So you apply it right to the clitoral area, massage it in. Also, the sildenafil is a nitric oxide enhancer, so therefore we're going to get blood engorgement to the area, which enhances sensitivity. And then third thing is we have naltrexone, which causes a release of dopamine in those tissues, and dopamine is the climax hormone. That's the feel-good hormone, the reward hormone.
Yes.
Oh yeah, we love dopamine. Mm-hmm. And so we get all three of those, and so in about anywhere from 30 minutes to an hour later, women's brains and clitorises are connected, and they're more likely to have a climax. And if they do, it's probably going to be more intense than normal.
Okay. My husband appreciates this for sure, because we've tried. Now, don't get me wrong. I love my husband. I do. I think he is fabulous. He's handsome. I'm attracted. We've been through all this. It's just that libido and just gone down through the years. And I'm so excited. I mean, Dr. Scott was like, you've got to try this. So your phone's going to be blowing up after this, Jim, with all my husbands, wives, boyfriends, girlfriends, everyone's going to.
I have 25-year-olds who are getting this cream.
What?
Okay. Yeah. Because it could be, who knows, psychosocial. It could be all kinds of things going on, because there's so many other, women are much more complex than men. You know that. I know that. Mm-hmm. And y'all have lots of moving parts. I mean, I have mostly women working for me because they're brilliant and they're productive and they're great.
Sure.
And the guys that work for me are going to be mad. I said that.
Right.
But I really do feel as though women have all these moving parts, body and mind, and so they got to get all those in line. And
right.
But we can help them with the hormones. That's at least going to remove an obstacle to it. Okay.
Oh, absolutely. So we talked in the first part of the series about female hormones. Let's talk about male hormones. We went through the female. Tell us what men should be on. I mean, everyone's different, right?
Yeah. To be honest with you, it depends on the symptoms and the levels. Okay, and most physicians, most of my buddies are traditional medicine doctors, so I'm not bad-mouthing traditional medicine doctors because they're my buds.
Sure.
They think what I do is voodoo sometimes. And everything I do is evidence-based, it's science-based, study-based, mm-hmm. And it's experience-based, because I've been doing this a long time, since the 80s. And so I've gotten good at it. So what we see in men is we test them for both estradiol and estrone. So those are two estrogens, because when we make our hormones in a man's body, testosterone is converted to estradiol or to dihydrotestosterone. So you got to know the pathways, And so a doctor should be testing both free and total testosterone, but he should also be testing estradiol and estrone. Then, whether doctors test dihydrotestosterone is not all that important, because we know that most men are going to convert their testosterone to dihydrotestosterone, but I see quite a few men who are converting the pathway down estrogen. And I had one gentleman who had every symptom of low testosterone, and his testosterone was fantastic, but he had crazy high estrogen levels.
Wow.
And so we just had to tamper his estrogen levels down to normal. We don't want to over suppress estrogen. Estrogen is important for men, but not too much.
Right.
Yeah, not too much.
Please allow me to ask probably a really non-intelligent question,
mm-hmm.
but man boobs, mm-hmm. is that because of
estrogen?
Too much estrogen.
Too much estrogen.
I see it.
Yeah, see, estradiol and estrone, which are the two estrogens I was talking about, are proliferative hormones. It means they make tissues grow. In women, they make breasts grow.
Sure.
And in men, they do the same thing.
Oh, dear.
So do we want too much estrogen? No, but you know what? It's interesting. We used to oversuppress estrogen. Estrogen is bad for men. Well, it wasn't. It protects our hearts, number one, if we have normal levels. Number two, it increases boom boom in the bedroom. Estrogen increases boom, boom in the bedroom.
You're kidding.
And so I didn't know that, and I thought I know every darn thing. You can ask my wife. I don't know every darn thing.
No, y'all don't. No.
We laugh about that in my house. That's
yes,
a joke. Okay?
Yes, we do that in ours as well. It's healthy.
And so I do like to make sure that men know that estrogen is not a bad guy. It's just that we don't want to have too much estrogen.
Yeah.
Okay.
Just regulate
balance. Balance is everything.
Mm-hmm.
Balance is everything.
Balance.
And then we look at DHEA levels too, and we look at DHEA sulfate if you're going to do a lab test, and that's a stable form of DHEA because DHEA is converted into testosterone.
Right. Okay. Yeah, and because my husband and I both take obviously very different doses of DHEA, but I was very low last lab, and boy, I couldn't get it back up fast enough. You know what I mean? And Greg was low too.
Well, DHEA helps with your brain. It's a brain hormone. It helps metabolism, helps immune system. So it's a big deal.
It's a big deal. I mean,
energy. Love it.
Yes. Yeah. I mean, I think I've been back. Dr. Scott upped my dose again, and what a difference. I just feel like I'm a new person. You were talking about your wife in the last show, just life-changing when she was in her 20s.
In her 20s and surgically induced menopause. And she fell apart on me. And 43 years later, we're still married. We still have, an incredibly great relationship. She's my best friend. She's my lover. All that, that cool stuff that, you just think, God, I'm so blessed to have somebody like that. She's smart. She challenges me, but she was falling apart on me when her hormones went south after the surgery.
Isn't it amazing, the power of hormones? I mean, the power. I mean, with or without.
It is one of the things that you can do that's just it's a no-brainer for me to get hormones right first. And then I see when I'm doing integrative medicine cases, I'm looking at all these different things in the body, all these systems in the body. But, hormones affect almost every system. So you get the hormones right, then you have less things to work on. Because I've always got stuff to work on people.
Right. Are men afraid of hormones?
Oh, absolutely.
Are they?
Because every man knows the myth, and it's a myth, that testosterone causes prostate cancer.
Okay.
It doesn't. Matter of fact, studies have now been shown, and a Harvard urologist revealed this and has become the international expert on testosterone and prostate. And he was given a task of saying, I want you to go speak at this conference about the dangers of testosterone for the prostate. And he's a urologist, and he's from Harvard. And so he says, I can find all kinds of studies. He couldn't find any studies. In 1942, there was one study on 3 men. One of the guys developed prostate cancer, and all 3 men were on testosterone. And they thought that a marker that they saw indicated a risk for prostate cancer. Turns out that marker was wrong, and so based on one case in 1942, urologists just assumed that testosterone caused prostate cancer. There was never a study that showed that. Well, now we know that men who use testosterone and maintain strong testosterone levels have a reduced risk of prostate cancer. If they do have prostate cancer, the cancer grows more slowly. Wow. It doesn't throw gasoline on the fire. It grows more slowly. And number 3, if you get treated for prostate cancer and then go back on testosterone, you have a reduced risk of recurrence.
Oh my gosh.
So those 3 facts alone, should eliminate any fear of prostate cancer and testosterone.
Wow. Unbelievable.
But the other thing that's going out, and I know you listen to TV, radio like everybody else, and there's always going to be a lawyer on there that says, man, if you are on testosterone therapy and you got a heart attack or stroke, call me. We've got money for you.
Yes.
Excuse me, my lawyer friends. Sure. Whenever I need you, you're really my best buds.
Right.
But those guys, are mistaken, because there are, matter of fact, a plethora, a preponderance of evidence of studies that shows that testosterone does not increase risk of heart disease and stroke. Matter of fact, University of Texas Med School at Galveston did a big study and found out that even men with brittle heart disease had less risk of heart attack and stroke if they were on testosterone.
Oh my gosh.
Less risk. And then Europe repeated the same study, and over 88,000 men studied in that study, and it showed exactly the same results. Less risk if men maintain good levels. But also, testosterone reduces risk of diabetes. Matter of fact, diabetes is more easily reversed if you're on testosterone than if you're not.
You're kidding.
Let's just say you get diabetes. You go, oh my gosh, your doctor tells you you got adult onset diabetes. Well, testosterone therapy increases the odds of you being able to reverse it if you do the right things, like start eating right and exercising. Eating right more important than exercise, believe it or not.
Absolutely. And we were talking in the first show about just the population whole. Do you want to take a pill, or do you want to actually move forward and eat right and take care of your body and exercise? And you said that your clientele, your patients are more forward thinking and saying, I'm going to change my diet, I'm going to change my lifestyle. And that's true, right?
That's true. And I have so many cases that come on, and sometimes they're not motivated until we talk about it and say, okay, what's the risk reward here? And like, for instance, I do a ton of work, and I told you about this, soldiers with traumatic brain injury.
Gosh.
And those soldiers, here we have heroes, 30-year-olds, 25, 27-year-olds, 33-year-olds, that in special forces and special operations groups. I mean, SEALs and Rangers and Green Berets. And these guys come in and they've got a testosterone of a 70-year-old man. And it's because of being blown up and everything else, and their brain's been rattled, and the traumatic brain injury, a concussion, is another word for it, causes the area of the brain that controls the testicles, the hypothalamus controls the testicles to say, hey guys, I want you boys down there to produce some testosterone.
Right.
And unfortunately, the brain injury causes the hypothalamus not to work properly, and so therefore they have very low levels of testosterone.
Right.
Well, testosterone is not only a sex hormone, but it's also a neuroactive steroid, meaning it works in the brain to help the brain heal. And I tell you, when I get these guys back on testosterone, they feel like themselves again. I mean, these are heroes. Like, I had one guy who lives here in Fort Worth. He was a ranger, 3 tours in Afghanistan, and we got him on testosterone, and he said, he came in 9 months later, and a few other things in my brain protocol, which I'd love to have a whole session about brain protocols.
That's next.
And he said, hey, Jim, guess what? What? He said, I drove over here. He couldn't drive. He had such PTSD, he couldn't drive. And then he said, guess what else? I said, what? He said, I got married. I said, you couldn't even leave your apartment. You couldn't go to the grocery store. How did you get married? He said, Jim, I felt like it. He said, guess what else? He said, Jim, I'm getting a job. He's reintegrated into society.
Just from testosterone.
And testosterone and a few other brain things that I do. And this guy is back. And so anyway, I and they say, Jim, the testosterone gives me almost an immediate lift, for my brain, because whether it's a female hormone or a male hormone, what we don't realize is these affect our neurotransmitters, like norepinephrine and dopamine and serotonin and GABA. These hormones affect those neurotransmitter system, and they also affect the brain. And so I just love the fact that both women and men on testosterone feel better.
Right.
They're healthier, and their brains are better.
Absolutely. So let me ask you a question, and I hope I'm asking you this question correctly. What is the correlation? Is there a difference between testosterone and erectile dysfunction? And erectile dysfunction, is this a libido? I mean, because my husband has a fabulous libido, but has erectile dysfunction. So draw the correlation, because you said it yourself. We're women. That's my population listening. We're going to fix our partners, our male partners. So tell me what's going on there.
I do love the fact that women are fixers. I mean, because I'm a caretaker, and so I understand that mentality.
Sure.
That I'm going to fix people. Just like I was trying to fix the young lady this morning, on the consultation. Right. And I love helping people to do better, and you can call it fixing, but I just say, I'm enlightening. I'm leading them to the water, to the water trough. They got to drink.
You got to drink it.
They got to drink it. So, for me, it is, this is a complex thing, not as complex as female libido.
Right.
But men, it is very difficult for us to have a full libido and full erectile function if we have low testosterone. Now, I have some men let's just say the range, just to give you an example, the range on men on testosterone, and the range is where 95% of men are. Okay. So it doesn't mean it's normal. It just means that's where we find everybody. Ranges from 250 to 1100. Okay. 1100, men in the 18, 20-year-old group, they're probably 1,000. That's their testosterone level. But when guys go down the bottom 1/3 of the range, 200, 300, 400, they're probably going to be having ED. Okay. Now, if we get the testosterone up, is it going to fix that? It's going to fix their mental approach to sex, the libido, but it's also going to affect ED. But it's not the only answer. Okay. Sometimes there's vascular damage. And if there's vascular damage, then they may need something like Viagra or the injectables that we mix there for men called Trimix, which has an injectable right into the penis, and it works every time.
Works.
And because a relationship between a man and a woman is important. I mean, or whoever, what kind of relationship you have.
Right.
I'm not judgmental.
No, not at all.
At my age, I can't afford it. I don't have the emotional energy to be judgmental. I just want to say, what, be happy.
Everybody be happy.
Be happy. But for a man and a woman, when we're talking about this, I can say that when we get testosterone right, chances are you're going to be a lot better, if not fixed. Okay. If you're not fixed, we got other things we can give to take you past the goal line.
Sure.
Okay.
Absolutely. So are you seeing erectile dysfunction in younger men?
Yes, I am.
I've heard this.
You know what? I had stress.
Yes.
We are fighting the saber-toothed tiger every day, all day long. Back in the old days, we'd fight the saber-toothed tiger, then we'd go back to the cave and relax with a cave woman, and then go back out and fight saber-toothed tiger and woolly mammoth, Well, now we don't get to go back and rest.
No.
We are under stress 24/7. We want to get ahead. We want to do this. We want to do that. And we're stressed out with COVID. And, I had one of my buddies, he's 59 years old. And his testosterone is 400, which is on the low side, okay? And he works out. I mean, he does all the right things. He eats right, and then he retires. He was a big deal at American Airlines, very stressful job.
Yes.
Retired. And within 1 year, his testosterone jumped from 400 to 1100.
Life-changing, wasn't it?
It was life-changing. But you know what? I'm stressed, and I work hard, but I love working, and I'm not going to give it up. So therefore, I'm using testosterone replacement therapy, and I've used both transdermal. We compound it in a transdermal form, and I also have used the injectable. I'm using injectable right now. Now, it's interesting for men. If you're going to use injectable, the old way to do it was to give your injection into the muscle, deep into the muscle, once a week.
Yeah.
We no longer do that. At least those of us who are enlightened. I heard about it from Baylor School of Medicine. We're doing some research on subcutaneous injections of testosterone. Subcutaneous makes a lot of sense for guys because it goes underneath the skin into the dermal layers, but does not go in the muscle.
Wow.
And so therefore, the dermal layers don't have that much blood supply, okay? I mean, all the blood supply is in the muscle. So when you put it in the muscle, I mean, you spike a very high level of testosterone on day 2, and then on day 5, it's almost gone. So here you are, day 7, you got nothing left,
Right.
But then when you do subcutaneous, you do a low dose twice a week, and you maintain a steady state level of testosterone all week long. And then you give it with an insulin needle. So, I mean, it's a tiny little needle that's like nothing. I mean, it's not even a mosquito bite. I mean, it's nothing. And so if I were going to use testosterone therapy, I would use either transdermal, and the pharmaceutical stuff is not concentrated. It's not a good choice, okay? We make it in a concentrated version, and we put it in a base called Atravus, which causes the testosterone to shoot through the skin into the subdermal fat layer, and then is distributed through the body.
Wow.
And it is incredibly effective. 90% of my men are on the transdermal because it's just so easy. You apply a fifth of a teaspoonful. We're talking a tiny amount, and that's it. Every day. Now, some men don't absorb as well, and so we use the subcutaneous injections on those guys.
Wow.
And it works great.
Well, great.
And we do levels, and we get levels, and you're like, right now my testosterone is about right around 900, and I'm feeling great, and I think I'm doing a little better than my buddies, that are my age.
You look great. Good grief.
I don't know about that, but I feel great inside.
Inside, that's
my brain is cooking. My heart's cooking. My muscles are okay.
Greg is now on cream. He was doing the shots, and I laugh because he is funny. But he said, I mean, I was watching. He's like, this needle is like a garden hose that it's going in me. That to do this testosterone. He's
it's
like,
a 10-penny nail.
Oh,
to get.
And he wanted me to do it. No.
It's an inch and a half long or 2 inches long, and you go into the muscle and plus the increase. There's a little bit increased risk with that intramuscular injection because since it spikes so high, it's actually going to cause a problem with blood thickening. They call it polycythemia.
Yes.
And so then you got to give blood. Now I do suggest that you give blood 4 times a year anyway because it's healthy. Matter of fact, people live longer if you're doing anti-aging medicine. You live longer if you give blood all the time.
Yes.
Believe it or not. But for that way we can thin the blood out. But why do that when you could give the subcutaneous and have very little chance of developing polycythemia,
Right.
the thickening of the blood.
Wow. Okay. So he went to the cream, and he likes the cream. He's doing okay. I mean, he's doing great on the cream. But I mean, I was just like, I'm not about to give you that shot at all. Now wait, back up. You just said, I went down a dirt road here. You give blood that's anti-aging?
Yeah.
Did you say that?
Yeah. Uh-huh.
What?
Yeah, I was at an anti-aging conference, there's several anti-aging groups out there that educate physicians, and as a pharmacist, I know I go to, okay, because I want to know what they know, and I don't want them to know more than me, right? Because I got to know every darn thing.
Of course.
I laugh about that.
Yeah.
But I can't help my patients if I don't know the cutting edge knowledge, okay?
Right.
And so anyway, they were talking. One guy got up there and talked about 15 minutes. He had a kind of shorty, but he talked about the benefits of donating blood 4 times a year. Your blood is turned over more rapidly. You have fresher red blood cells and healing factors and all that stuff. Your marrow kicks into gear. So it makes sense.
It does.
It's just one more thing you can do. And plus it benefits society, right?
It does. And I am all about anti-aging. So I am going to be a little selfish here because my husband has asked this question multiple times, and it's about human growth hormones. Can you shed any light on that? Is it necessary? And my husband we compete just as much to stay healthy.
Well, some doctors don't know how to test for growth hormone. We don't test growth hormone. Growth hormone is converted rapidly into the body something called insulin-like growth factor. It's hard to say fast. So it's IGF-1 is the test. And so you do that test first thing in the morning, and you see what your level is, IGF-1. And if it's in the bottom 1/3 of the normal range, that means that you are adult growth hormone deficient.
Okay.
And that means that you're a candidate for getting growth hormone. Now, doctors are scared to prescribe growth hormone. Now, here's why. The medical boards are likely to want to take their license away if they feel like they're using it for anti-aging purposes.
Oh.
Because growth hormone is not a growth hormone. It doesn't make your muscles big. It repair hormone. It repairs things, which is why, like for some of my soldiers, am I looking at growth hormone? Absolutely. I'm looking at IGF-1 levels on them because if they have low growth hormone, their brains can't repair. So yes, it is a powerful hormone. It's a repair hormone, but you can get too much of it. And so, my number is 220. I'm 67 years old almost, next month, and my growth hormone level is 220, which is a really good, strong level. Like most people who are injecting growth hormone want to get to my level. But if you do the right things, if you work out to muscle failure, if you sleep well, if you don't eat a lot of simple carbs, you're going to have a better chance. And using hormones, you'll have a better chance of getting good levels of growth hormone, and that's going to slow down aging. I've seen people who had low growth hormone start using it, their gray hair turns back to normal color. I mean, I see skin looking 20 years younger. I mean, the changes are dramatic, but some people say if a little is a little good, a lot does a lot of good. It's not like martinis, okay? A little is a little good, a lot does a lot of good. This is one of those things that you really have to monitor. And so if a doctor does prescribe it, he's got to be really careful about monitoring you 4 times a year and making sure that your level is appropriate and not too high. Now, if you, one of the things that my doctors are doing is they're prescribing sermorelin, which does not put them at risk by the medical examiners, okay? And sermorelin is an injectable that causes the body to release more growth hormone. So it's actually growth hormone releasing hormone. And so instead of giving growth hormone, you give growth hormone releasing hormone, you release more growth hormone, and you never go too high with this. I never have to worry about it. It increases their levels by 30, 40%, and they do better. They do better.
Unbelievable.
And there's no risk for the doctor, because I love and appreciate my doctors. I don't want them to have their licensure jeopardized.
No, not at all. At all. I can't even tell you how fabulous this information is, because I think there's a lot of fake news out there. There's a lot of inaccurate information. Just my girlfriend sitting at a table, like inaccurate information. And I mean, you've given it to us, and what a gift. What a gift.
Thank you so much.
Your passion is showing in what you're doing, and I appreciate you so much.
I love doing this. I love sharing, because all I want to do is I want people to be healthier and happier.
Yes, absolutely. Will you come back on and we'll talk about brain health?
This is way fun.
Oh, I appreciate it so much. So everyone, Las Colinas Pharmacy, Compounding and Wellness Center. I mean, you guys started this in 1984. You don't look like you started this in 1984, but what a great center, integrated and functional medicine. And we're going to find out how to follow you, and everybody's going to go get the Yell gel for sure. So everyone, I hope you got to watch this on YouTube and listen and rate and review. We're trying to get up in that Apple, Spotify world. Follow along all my platforms, Tiffany C. Blackmon or Tiffany Blackmon. And everyone, take your hormones, keep being healthy, and keep being fabulous.